Hello to all our future nurses. Welcome to Meet Our Nurse, a segment where we're going to be talking with different instructors and nurses here at Kaplan and just learning a little bit more about them. So I have with me here today Dr. Susan Sanders, who is the VP, Vice President of Kaplan Nursing. And we're going to be answering some questions that are here in this Kaplan mug. We're going to just be picking them at random. And I think we'll go back and forth. So do you want to pick out a question and
Sure.
We'll see what it is, see what the answer might be?
It's kind of scary.
They're all NCLEX questions you have to answer on the spot.
So shall I read or do
Go
you?
ahead.
Okay.
Yeah.
Nursing career, is it really rewarding? Well, I would say it's extremely rewarding, and being a nurse has afforded me all types of opportunities. I've been able to take care of patients, save lives, work with students, work in hospitals, just a huge variety of opportunity being a nurse. And I encourage everybody to be a nurse. I tried to get my children to even go into nursing, but it's extremely rewarding to see how you can impact not only the patient, but also their family.
That's great. We've heard a lot of the same stories from other nurses as well, and nobody says it's not a rewarding career. I think everybody talks about how it's a hard career, but definitely a rewarding one. Oh, this is a good question. What's your favorite topic to teach? Because we know you're an educator as well.
So my background is emergency and critical care. So I love cardiac, sick medical patients, not particularly trauma related to emergency, but those that come in kind of like a puzzle. They come in, they're very, very sick, and you're trying to figure out what's going on with them. So really, cardiac events and emergencies is my favorite.
That's awesome.
You know what? I'm going to shake things up and ask you a second question. We'll do it in this order now. This is a good one for anyone who's watching, actually. What would you say to a new nurse who might be out there just starting out in the workforce?
I would definitely say take every opportunity. Volunteer to work in different sections of the hospital or in the community. The more you know, the more valuable you are. And the more that you put into your career, the more you get out of it. So I would say that that's extremely important.
That's fantastic. Let's do maybe two more, and then I know we have 20 questions here. So do you want to pick out the next question?
Let's see. My favorite moment of being a nurse. Well, I'm not going to tell you how many years I've been a nurse because that would date myself, but it's been decades, suffice it to say. So I actually can remember several sentinel moments in my career, and one of those, I recall an elderly patient when I was probably about mid-career, a lady and her husband, she was ill, and he was helping take care of her in the hospital, and I got to know him extremely well because they had been married probably 60 plus years. Wow. So he was as much of my interaction and patient care as she was. And you know, ultimately she did not make it through the illness, but he would always come back to see me at the hospital. So I remember that fondly.
It's amazing how nurses have such an impact on their clients and patients, and it goes to show with stories like these, and that's, I'm sure, very rewarding, as we talked about earlier, to be a nurse and to have those experiences. So here's the last question to tie things up today. What has your experience been like at Kaplan? How would you summarize what it's been like to work here?
Wow, it's been really great. I believe that professionals working with professionals brings forward a very team approach, professional work environment, and we can learn from each other. And our focus is all the same. You know, our focus is helping students and be successful in their chosen career, which to me is nursing, which is the best. So for us to work as a team, to make that happen, work with students and faculty. It's just been the greatest.
That's wonderful to hear, and like I said, we're so glad to have you on the team.
We want one more.
You want one more? All right, we want one more, so let's pick out one more. Let's do this one. It's actually a tough question. The hardest thing you had to do as a nurse?
Well, it comes in various job duties, you know. As a nurse working in an emergency, of course, talking to a family about a bad situation. In nursing school and teaching, it comes with the realization that a student's really struggling, and then how can I help that student?
Right. Should we do one more?
Let's don't end on that note.
I'll end on a positive note.
If not, I might just, here we go, this is a good one. What inspired you to become a nurse?
Interestingly enough, as a child, I was accident prone. So I had a couple of knee surgeries because I was, you know, you can't tell it by looking, but I was an athlete at that time. And so I had a couple of knee surgeries, and in the hospital setting, I was impressed and really motivated by the nurses who were caring for me. And I liked math and science courses, so when we talked about background and what I needed, I thought this would be great. I'd love to do that. And they inspired me to take care of patients.
That's fantastic. And we've heard stories like that from other students and educators as well, that it was often the nurses that they encountered through any situations they had to go through that inspired them to want to do the same for others. So it's wonderful to learn more about you and what you do here and what inspires you as a nurse and what first inspired you to become a nurse and just some of your favorite topics to teach and everything else we discussed today. So Susan, I want to thank you so much for coming on to the Meet Our Nurses segment. If any of you out there have any other questions for Dr. Sanders, please be sure to leave them in the comments below, and we'll reach out to Susan and get any questions, answers to those questions that you might have. So thank you all, and we'll see you in a future session of Meet Our Nurses.
Thanks. Thanks, Matt.